Hi, my name is Matthew McCormick, and the subject for my presentation is the prevalence of acute and/or chronic injuries in high-intensity functional training modalities. I chose this subject for its relevancy towards the area and industry of rehabilitation, as identifying at-risk populations is critical in employing effective rehabilitation strategies. Just some background literature on the dependent variable of acute and chronic injury. It's important to define these terms before we can speak to them with respect to this presentation. Acute injury, very simply, can be viewed and minimized as any sort of blunt force trauma to soft tissues. We can see these as contusions, as fractures and the like. Chronic injury being more the long-term overuse of connective tissues. We'll see this primarily in tendinitis and tendinosis, issues that involve the pain spasm cycle. And though they both have their severities, acute injury can be more thought of as the more severe of the two. This is where you'll see catastrophic injuries as well, such as brain injuries, spinal cord injuries, things like that. Life-threatening injuries tend to come from acute injury. Moving on to the independent variable of high-intensity functional training, I chose this because it's a very polarizing phenomenon in our culture now. It gets a lot of airplay, on television, word of mouth, and a lot of perception surrounds it, and there's not much literature on these questions. So it was pertinent to develop a research question regarding this methodology of training. And of course, first we have to define what high-intensity functional training is. And even though that there are many sort of commercial iterations of high-intensity functional training, definitely the more recognizable company would be that of the corporation of CrossFit and its sort of global presence. So we really can think of functional training, high intensity, as these short bouts of physical activity that raises the heart rate to high percentage levels, followed by long durations of rest. And the term functional itself can be thought of as a multi-joint or multi-planar movements that help improve many aspects of physical performance, such as neuromuscular efficiency, quarter extremity expression, and overall capacity in the human movement system. So as stated before, arguably the most recognizable form of high-intensity functional training would be that of the corporation of CrossFit, which has since become a household name. And along with that, because it has become a polarizing entity in our society, there comes a lot of anecdotal sort of perceptions and claims over this philosophy and methodology of training without much literature or evidence to support some of those claims. So that leads us to the purpose of this presentation. The purpose of this literature review and presentation is how we can utilize a quantitative, a qualitative, and mixed method approach to answer the question with evidence-based research, the question of what is the prevalence of acute and or chronic injury in high-intensity functional training modalities. First, the quantitative research approach. The research question here is very simply just wanting to know what the prevalence of acute and or chronic injury is in the sport and training methodology of high-intensity functional training. We're not really concerned with categorizing whether it was acute or was chronic, so that's why we put the and or. We don't want to show exclusion or bias towards one or the other. So we just lump these two terms in as a whole, as we just want to know the incidence of injury, whether it was acute or chronic. For this method, a non-experimental research design is what I'm suggesting of survey instrumentation, a survey design. One, coming back to the simplicity of the question, essentially we just want to know if a participant has indeed been injured while performing this type of training. This type of method, the survey method, is of low cost. It'll help us reach a large amount of participants, so we'll have a nice large sample size. Efforts extending beyond this for validation purposes, such as trying to obtain official medical documentation or efforts of the like, would prove to be, at best improbable, but most likely impossible, and would come at quite a significant cost. So that's why we're recommending the survey design approach. So for our variables, you'll see that our independent variable is participants who subscribe to the methodology of high-intensity functional training and who are actively participating in said training. Our dependent variable being acute and or chronic injury. And these variables are going to come into play a little bit later when we talk about data analysis and choosing the right statistical test to show us our incidence. So you'll see that for our independent variable, we have one category, and inside of that category, we'll have two groups of the dependent variable, either injured or non-injured, and that'll come into play in helping us choose the appropriate statistical test. To answer the research question, we want participants who have a body of experience in high-intensity functional training. So inclusion criteria is going to include that these participants have at least engaged actively in this training methodology for no less than 6 months and no less on average of 3 days a week. Some exclusion criteria is we are going to try to really isolate injuries that occurred due to the nature of high-intensity functional training. And so in an effort for that, we're going to exclude any injuries, any pre-existing conditions, essentially, even if that condition existed before but was exacerbated by the training. That's still going to fall under our exclusion criteria. And also injuries that cannot be contributed directly to high-intensity functional training. So if there's a question, or if there is if there's not much assurity that this injury was sustained during the high-intensity functional training, that's also going to fall into our exclusion criteria. And once again, our instrumentation is going to be surveys that ask these direct questions. So as stated before, the survey questions are going to be fairly direct and simple at that, with the main question being to the participants: have you or have you not sustained an injury while performing high-intensity functional training? Other questions will help in an exploratory nature or an explanatory nature, such as how many injuries have you sustained. This will just provide some good data for our discussion session, even though the responses received here won't necessarily create another group or any subgroups. We're simply going to categorize them as injured versus non-injured, and how many injuries were sustained is not going to play a factor in our data analysis. And then in hopes for internal validity, we're asking participants for their surety that the injury sustained was indeed from high-intensity functional training, and any responses that may be lacking in a surety of that would be subject to our exclusion criteria. Once the data is collected, the preferred statistical test here is going to be the one-way ANOVA test. The ANOVA test is a great tool, especially for survey responses when trying to determine the significance of those responses. And it fits our variable criteria in the fact that we have one category, one independent variable, participants who actively participate in high-intensity functional training. And within inside of that category, we have two groups, either injured or non-injured. And the one-way ANOVA test will be able to provide us with an answer whether those results are significant or not. Once we're able to determine whether the prevalence observed is significant or not significant, it is important to comment on the limitations of this study with respect to validity. The first being the under or over reporting of injuries. We're never going to be completely sure, even though efforts were made in the survey questions. Still, we can never be completely certain that an athlete or a participant is going to respond that an injury sustained was indeed and in fact due to high-intensity functional training. And then some other limitations are those that are naturally inherited inside of survey design with respect to researcher bias, how the questions are formulated, as well as potential bias from participants. Participants may try to anticipate what the motivations of the study are. They may try to anticipate the research question. And if a particular participant has a fair amount of allegiance or loyalty to their methodology of training, that may be potential for them to skew their answers in a more positive light. For our qualitative research approach, we want to observe the participants' relationship and perceptions with the concept of injury. Specifically, do they feel that they're at a higher risk or at a lower risk, or they're at no different risk if they were doing something else? And for this, we think it's appropriate that this is based off of a grounded theory design, because we want to cultivate a theory or an idea or come to conclusions based off of the data received as opposed to the other way around. And this is going to be most effectively done with a face-to-face, one-on-one interviews. The goal of this qualitative approach is really to just better understand the psychology of a participant who actively engages in high-intensity functional training. For example, we may get a response back from a participant who perceives their risk to be relatively high, and that could lead to follow-up or subsequent questions of, okay, then why do you continue with this training? And hopefully from there we can begin to see some patterns, some themes emerge, particularly interested in what these participants' perception is of a normal to abnormal state. What does a normal state look like to a high-intensity functional training participant? What is their perception of injury and pain? The idea of pain being very subjective, not only in the athletic community, but in the general population as well. So this qualitative approach could really help us begin to understand maybe some differences that this population may experience with the perception of pain, and maybe how some of those perceptions will correlate to their training frequency and why they train as much as they do, or maybe not train as much as they do, and how they feel about that. And with respect to the participants, we'd be looking for the same sample as that we saw in the quantitative approach. Participants who have a body of experience in this training methodology. So participants who are, have actively engaged in this training for no less than 6 months and average about 3 sessions a week. When collecting our data, it's preferred that these interview questions would be appropriate for them to be one-on-one and open-ended, which would hopefully help lead into subsequent questions after the initial question to foster some better understanding. Questions very simply kind of coming back to a running theme of, how often do you perform this type of training? And from there, in a more qualitative respect, why do you perform, as much as you do or as little as you do? An also interesting note is beginning to understand the participants' relationship with pain and injury. How do they view pain and injury? Is it different than how maybe, for lack of a better term, the general public or population would perceive pain and injury? Could we maybe see a running theme that athletes who participate in high-intensity functional training have a much lower perception of pain, right? So there's more resilience there, almost like an immunity to it. They're almost desensitized to it. Is there sort of a running psychology there? Would they begin to omit maybe some injuries that they don't perceive to be injuries? For example, medial elbow pain, does that even register with them in terms of being an injury? So hopefully keeping these questions open-ended would be able to lead us into the discovery of some of those insights. So once all the data has been collected and it's organized, we've sifted through all the data. Now comes the real interpretation of it, and that starts with coding the data, trying to look for running patterns. And then from there, we can get more descriptive with it, and then finally have a representation of, through grounded theory of our final conclusions. So an example that could be, okay, so we're seeing, participants A, B, and C. They have a knowledge of what injury is. They know their risk, and they have a low perception of pain. That could be coded in as one particular group. And then participants D, E, F. Maybe they don't have a full grasp on what injury is or looks like. They have a knowledge, they don't know their inherent risk, or they're unsure of their inherent risk, and they have a high perception of pain. And we can categorize them in a group. And once again, like I said, from there, we can begin to see some running themes populated from these codes, and eventually lead us to a representation of this data, which is ultimately what we're trying to get to, and that representation being, the psychology of a high-intensity functional training participant, and their relationship with the idea of injury and pain and risk. So finally, for our mixed methods approach, the research question is, will the prevalence of injury in high-intensity functional training change the participants' perception and willingness to continue with training? And this is best going to be done through an explanatory sequential mixed methods approach, because we want to get the hard quantitative data first. And then from there, we're going to shape our qualitative question. So basically, we need to determine what the prevalence is first before we can go back to the participants and say, okay, now that we know that, say, the prevalence is 30% of people who participate in this training are injured, does that change your willingness to continue with this training? And so this is best going to be accomplished with the explanatory sequential mixed methods approach. Our concepts are going to be, once again, just the prevalence of acute and/or chronic injury and the perception of the safety of that training methodology to the participants who took part in the study. And we're going to use the same inclusion criteria as we have been with participants with a healthy body of experience, no less than 6 months in the training methodology and no less than 3 sessions per week. The data would be collected in 2 portions, first being the quantitative in attempting to determine the prevalence of injury in high-intensity functional training. And that can be done with the methods as previously discussed. Once that's collected, that's going to help shape your qualitative questions. So you may have an idea of where you want to go, but this data can really aid you in guiding the questions and what you want them to be. So say there turns out to be a high prevalence, if we run it through the ANOVA equation, and it turns out, hey, that these results are significant and there's a fairly high prevalence of injury in high-intensity functional training, well, that may shape your qualitative questions of, due to the inherently high-risk nature of this methodology, why do you continue or would you continue to elect to take this training? Or maybe the data will show you something different and that'll change your qualitative questions. And due to the fact that the data collection occurs in 2 phases, analyzing the data, it would be appropriate to analyze those in 2 phases. And hopefully the qualitative is going to explain further your quantitative results, and we would be able to find some correlations or patterns between the 2 sets of data. In summary, due to the lack of literature that does exist pertinent to this presentation topic, I feel that it would only be appropriate to employ all 3 of these strategies and approaches into answering the research question to begin to build a foundation of literature and evidence. More specifically to the field of physical therapy, identifying at-risk populations will only aid in developing more effective treatment plans and protocols. Working on this presentation, I see, due to the direct nature of the question itself and the instruments that would be utilized, that this may be an appropriate topic for my capstone project. But we'll have to see how the rest of the year unfolds, and maybe another question that would be of more interest and more need of answering will arise. Thank you for your time.